A normal service would be like a doctor and a nurse will go out to the house and they'll send a carer or whatever it is. But for us, we are the first specialist medical service to the home. Meaning, so if you say you call us up and we send someone to go to the house, it will be a doctor and a nurse does a whole full assessment of the house and the patient, whether it's the medicine, the home environment, of course, the person itself. And then after that, they'll get all the assessment and then pass it to the specialist.
Oh.
And then the specialist can then do a plan for the patient. And then maybe if the person needs more physiotherapy or occupational therapy or speech therapy, something like that, and then or needs follow up for maybe wound changing or medication, that can all be organized straight after. And then say the person is sick for like 2 or 3 days. Once the person gets better, then it's up to the specialist to decide whether we would discharge the patient. So it's not like, you send a doctor and then you just do it yourself. It's more like an inpatient kind of like situation at the home. And if people really need, they can actually get Dr. Gordon or the specialist to come out to the home direct also if they want to. But it's a bit expensive because he's a specialist.
So right now you're the only one in Malaysia?
In Malaysia.
Whole of Malaysia?
Whole of Malaysia, running through a specialist service. Yeah.
Oh.
Yeah, running a specialist service at home.
How did you get licensed?
So it runs through the doctor's license.
Oh.
So it's almost like the company that manages the doctors with their own licenses that go out.
So why you're so special? Like
Australia, I think there's like 300 over home care services, whether it's allied health, doctors, nurses. But in Sabah, we are the first actual specific mobile service to the home. So we're pioneering in this service. Yeah.
So instead of taking the patient to the hospital, you send the specialists and doctors to the patient's home.
So I give you an example. So there's a patient of ours that the father is actually bedbound. He's always getting sick because he has the pig feet. So means he eats through a bag that is connected to the stomach. So he always get infection. So for the last 1 year, he has been going back and forward to the hospital once a month at least. Once we introduce our service, and just before we introduce our services, apparently the father was going in every 1 week or 2 weeks. He'll go in once because he gets sick, right? But in the last 2 months since he started with our services, the doctors at home, the only time he went to the hospital was just to change the tube for the bag. But he hasn't gone to the hospital at all because we can look after him at home.
Mm-hmm.
And then we can even for the first time bring him out on a wheelchair and just go for a walk. He hasn't been able to do that for 2 years. Yeah, so that is the type of patients we see. They're stuck at home, they're disabled, and it's very difficult for them to go to hospital. And it's very costly also to go to hospital.
But usually how much does it cost per trip?
I think because of the ambulance, I don't know if it's a few hundred ringgit, just an ambulance trip once. And then you stay overnight in private hospitals. I think different private hospitals are different costs. But it's and they have to pay privately, so it's not under insurance. So it's quite expensive. But whereas here, we cut the cost of, the overnight stay, and also we cut the cost of ambulance. So our cost is usually just the doctors going out there, the medication, maybe some of the equipment and tools we use. There's one patient that got really sick at home, and she had discharge coming out, and she couldn't breathe properly. We were dealing with end of life, so we actually been looking after a lot of clients who are end of life situation. So the family is like, instead of having to go back and forward to the hospital whenever she's sick, maybe we just give her comfort care at home. So when she got sick, the doctor will come in, the nurse will come in, check the medication. And then because she was on specialized medication through the IV drip, the nurse will go there 2 or 3 times a day. And the doctor, it's just like a hospital scenario where the doctor follows up every day. So for 3 nights, 3 days, the doctor and the nurse will come in a few times a day for the nurses, 1 time a day for the doctor. So once everything clears up, we have the blood test done also. So we have the blood test on the first day. And then the last day, the third day, we did another blood test. We could see the markers all go down. And then the doctor can say, or discharge. But she will also have carers at home. Whether the family hires their own carers to stay at home, or they use another company to hire carers, because we don't have that service at the moment. We are just doing the specialist service to the home. And also there's another family that does, we do companion nursing for them. So for example, the son his mother had like heart problems for the last 4 years, and maybe once or twice going into hospital, but very difficult with him traveling. So he said he only dares to go for holiday for maybe 4 days maximum, and he's always coming back straight away. The mother is able to walk around and everything, but they have someone stay in care, but they're so worried that something happens, so he doesn't dare to go. So now we have this service. We have companion caring also, meaning we hire like very experienced retired nurses who also have done caring jobs or whatnot, and they will go in. They'll do everything. So that means from cleaning to caring to cooking if they need, feeding, medication, as long as it's nothing like inserted like needles, drips, nothing of that sort, and just looking after them the whole day. So the person can actually go away for a holiday longer. And if anything goes wrong, then you just have our medical services come. Because we're all one ecosystem, if you think about it as an ecosystem. And then we also can train. So for example, there's a client, the parents just had a stroke. So when the person just had a stroke, the carers are actually family, but they have no idea how to look after the parents. So these are where our nurses can come in and train the family, tell them what to do. The bed, how is it? The toilet, is it slippery and all this kind of stuff. It's almost like helping them just make them live at home, more accessible for the person who is disabled now.
Experience in Australia.
So in Australia, I was a physiotherapist. I graduated quite over 15 years ago. I specialized in home visits, also going to the house. So I started a company in 2014 where we started with physiotherapy, then it grew to occupational therapy, massage, nurse, speech, dietitian, podiatrist, all to the home. And as we grew, we also did nursing home contracts. So we had about 12 nursing home contracts. So we had the allied physio and the OT in the nursing homes looking after all the patients there. We also then did rehab in the hospital. So inpatient rehab. So physios that were seeing patients that were staying in hospital. So we were a private company inside the private hospital. And then about 3 years ago, a health insurance company bought us. They bought us because not to make money, but to save money. Because they want to also give experience for patients that they stay in hospital, but they don't have to stay for so long. They can actually go home earlier, and they provide our services through our physio company. And they don't have to pay a cent because insurance company pays for everything. So we were the first allied health company to be sold to an Australian health insurance company in the whole of Australia. So it was a very good, big honor to have that done.
So may I know how much did you sell it for?
Oh, I guess it's, I think, should I say? But you can look it up. Life Ready sold to HBF. Yeah.
A lot of money,
No.
No, not a lot.
Yeah. I would say we were blessed.
Just enough.
Just enough.
Just enough. Not too much.
So to come back, so I decided to come back, and when I heard that there's no such service of home visiting, and also in the last 10 years, I've seen from privatization of government, no government funding, to now almost 90% all government funded with insurance funded for home services. Because they free up hospital bed to have services at home, especially during COVID, or it just boom, right? And then also insurance companies, so we can free up hospital beds so more critical patients can go into the hospital, and then we can have all that services provided to the home. So it's just to see that Malaysia has none of these services yet. It's like I can rewind time and then start and do something for Sabah and Malaysia actually. Make Malaysia. So the dream is to actually make
Sabah great again.
No, not only that.
Sabah Maju Jaya.
Sabah Maju Jaya.
Sabah has the potential to become international retirement haven. With what we can build. So.
But we need visa, long-term visa.
Long-term visa, yes.
That's the only thing we're missing.
Yeah, and if we can build really good villas or nursing homes in the future, I really believe with building these services here and also building an academy, we can start to train a workforce that can help look after a lot of these retirees that are growing older here, and also bring in international people that want to retire in Sabah. It's such a beautiful place to until they go to heaven.
Okay.